This episode is based on a true story. Some scenes have been dramatized. Always consult your doctor for medical advice.
Here in the land of two seas, Bahrain, healthcare is one of the priorities in the kingdom. Health, as we all know, is important for human happiness and our well-being. And in Health Hub, we answer your common questions and bring to you information about the advanced medical facilities in Bahrain. In today's episode,
I said surgery in my back. It's come in my mind like I will not walk anymore. Something it will be wrong, cannot walk again.
Now 2 days after his procedure.
I think we've all suffered at some point in our lifetime from either the occasional mild form of neck pain to the more severe chronic form of back pain. Regardless though where you fall on this particular spectrum, I think most of us, whenever we get that painful attack, we rush for the painkillers. We rush to relieve the pain, even with something as simple as a hot pack. Have we ever though stopped at that point and thought to yourself, what might be actually causing my pain? What might be going on inside of my body that is triggering this particular pain? I'm Dr. Khawla, and in this episode we're going to dig deep into neck pain and back pain.
My name is Hamdan. I trained in the United States and worked there for many years. My life is just an average kind of daily routine, taking care of patients, doing clinic and surgeries, in addition to the social activities that people kind of do during their days and weekends. Yeah.
My name is Zuhair Musa. The story is behind my pain. It was a long time ago with car accident. Then I go already to some hospitals and they said to me it will be all right after a few months, few years. Then the pain is already gone, then come back again. Then I visit many hospitals. They said to me it's all about muscles. Problems. You need only a simple massage, you need a simple exercise that will be help for you.
Hi Zuhair, how are you?
Very good.
So I understand, Zuhair, that you've had a very long and maybe painful journey with back pain.
Yeah.
Can you tell us more about your pain history?
Yeah, it's actually, it was the pain with me 15 years ago. I'm suffering for that pain for long. I visited many hospitals, but the doctors always, they said to me like it's all about muscle problem. And also I traveled to Philippines for that, the same things they told me. But when I get a really painful a lot, I search in Facebook, I found Dr. Hamdan, he's a Bahrain specialist. Then when I visit him here, he check me and he make x-ray, everything to me. Then he find out what's my problem, and he suggests me to do a surgery. And this is, he told me like, this is safe, simple, and don't worry about it, because you know, if something at the back, it's really stressful. So I go ahead and I try it, and it was really successful.
Good. So I understand that you just had surgery 2 days ago.
Yeah.
You look great, Zuhair. You really do.
Actually, also when we did, I don't believe myself as well when the doctor said to me that you will leave today. I said, really? He said, yes, you can go walk and go home.
I mean, is there any pain right now?
No,
any weakness anywhere?
No, I don't feel it from the first day. Yeah.
That's great. And you're feeling your usual self?
Yeah, actually.
That's very good. And the pain, do you find that there is relief?
Yes, it's already, you know, this is a surgery. You will feel the pain only in where they did the hole. But for overall, no.
That's great.
I'm already fine.
That's great. Let's go see the doctor
Sure.
then. Let's go. How is your life now? Do you work? Do you...
For now, I'm taking rest at home after the surgery.
Come in. Hello, Zuhair. How are you? Good to see you again.
How are you, Dr. Farouk?
I'm doing fine, thank you.
Thank you for having us today.
You're very welcome. I'm glad to have you here.
Thank you. I am here with Zuhair, and I was just talking to him a second ago about his surgery a couple of days ago.
Yeah.
Sounds like it went great.
Yeah.
We did his surgery 2 days ago.
Okay.
Zuhair was a bit hesitant about his surgery. He had back pain and leg pain. And he decided to have his surgery. I did explain it to him in details. And everything is fine. He is now 2 days after his procedure. How do you feel, Zuhair?
Yeah, it's better now, actually. From the beginning, I finished the surgery. I don't believe that I will go home in normal way. I'm walking normal. And the doctor was telling me that, but I don't believe it. But then I feel really happy to go home without pain, without anything, in same day in the surgery.
He was a bit hesitant, but I did explain it to him in details, and I did explain it to him also. It's called a minimal invasive spine surgery. So this procedure is a special procedure. We do it under local anesthesia. Patient is awake during the procedure.
Okay, so I can like talk to you and
you will be sedated, so in and out of sleep. So if I talk to you, you will respond, but usually you'll go back to sleep. Okay. But the patient is awake. Procedure takes less than an hour. A very small, tiny incision. We use a special scope to do the procedure, and remove any kind of nerve compression or disc herniation during that procedure. Then after procedure, we'll put a small dressing, and the patient can go home right after the surgery is done, same day.
Oh, wow. Zuhair, tell us about the actual surgery experience. Do you remember anything?
Actually, I don't remember that much because the doctor was explaining to me what's happening that time. Because it's like wake and not wake, like I'm in a dream. But it was really good. I was laughing about what I'm saying about.
Wow.
Yeah.
You know, it's funny actually. He was just put his hand like this, and he was talking to the anesthesiologist and making jokes.
Wow.
And
while people were playing in your back. That's impressive.
Zuhair kind of telling you his side as a patient, but the technical side of it, it is a full surgical procedure. It is done under local anesthesia, it's done under sedation, but actually the work at the site of the problem where the disc herniation or nerve compression is similar to the open, and it is fairly technical because you're working next to the nerves, and the patient, you have to be get the patient comfortable while you're doing the procedure. But results are usually very good, and you can see Zuhair happy about his results. I can show you in a minute his incision, and generally the patients within a few days they can go back to their usual activities.
Very good,
yes.
very good. Probably people who are listening are wondering, am I like Zuhair, can I have this surgery to cure my really bad back pain?
Yeah, if you need the surgery, we will advise you. Generally, there is an evaluation which require physical examination and also require an MRI, which is a study to look at the nerves and the discs. And if the patient needed the surgical procedure, we will explain it to the patient in details, and then we will.
That's good, that's good. Okay, so why don't we go and see the incision? Yeah.
Hello, Zuhair. We're gonna have a look at your wound, so if you can just stand up. Doctor, you can come closer, turn a little bit there. Okay. And Mary, can you help me out, please? So, what we're gonna do, remove this small dressing, Zuhair. Okay? You wanna slide back a little bit and get a little bit more? A little bit, there you go, excellent, okay. So
these are very small bandages.
yeah, they are. They are actually. The patient can shower, take a full shower with these on. The little splash of water shouldn't hurt it. And generally, patient do not need to change the dressing for 2 weeks or 10 days until I see them again in the clinic. His surgery was only 2 days ago. So here I'm going to remove the dressing, okay? If you feel a little bit of pulling, I'm sorry. There you go. So this is one disc, and this is the other disc.
I see. That's why there are two.
Yeah.
Okay.
So because one was on the right and one on the left, and I'll explain to you the incision. If you look here, see that is the incision here.
Yeah,
That is the incision there.
Yeah.
Okay, and this is the incision on this side.
I see.
Yeah. In another week or so, we remove this little stitch here, and basically that's it. Well, doesn't need any more dressing. Yeah.
So if I have one herniated disc, I only need one of those incisions.
Correct. Yes. And sometimes, if the disc herniation on one side, 2 levels can be done through one incision. Yeah. Yeah. Actually, a patient was done right before him, has 2 levels on one side.
Zuhair, do you have any pain right now in those incision sites? No, right?
Yeah, you can face the doctor. You can see it.
That's
There you
okay.
go.
We're all done.
Yeah.
Yes, good. No pain, right? And walking
And surgery
is
was
fine.
what? 2 days ago. There you go.
Good. That's
Yeah.
excellent.
Yeah,
Very
yeah.
good. Very good. Well, thank you for giving us the opportunity to take a look at it.
I'm
We
very glad
appreciate
taking
it.
care of Zuhair.
Yeah.
And I'm happy he's a very good patient, and I really wish him good luck. He's a nice person.
We all
Yeah,
do. We all
yeah.
wish you good luck. Did you know that most people suffering from an episode of back pain do not necessarily have a serious medical problem? And most often, the pain will go away on its own in a few weeks' time. However, there are certain things that you can do at home to speed up your recovery. This includes applying gentle heat packs, using over-the-counter prescription medications after consulting with your doctor, and staying active.
The success rate of this procedure, I've published some of the results, and it's also there are some other publications from other surgeons that do this procedure, and the success rate is in the 95% range. So if you take 100 people, have the same condition, and do the surgery that I showed to you, 95 of them, 95 out of the 100, their life go back to normal, and they are very happy about it. Yeah. So.
My life after surgery, of course, I plan for different things, which is as a new life for me. First things, which is I will move for a different company. Second things that my plan to reach my dream, which is the pain was stopped me for many things, which is back to gym, but of course after a few months as the doctor advised. And my life, like to go travel, enjoy in your life, yeah. Go back to normal. That's what I'm waiting for 15 years.
After 15 years of Zahir suffering from his back pain, he will finally go back to his normal life with no back pain.
Every week at Health Hub, we bring you the latest and most relevant information to your own health. I'm Dr. Khawla, and I'll see you next week. Stay safe.